हर दिल की है एक कहानी, हर आवाज में है रोशनी। आइडियाज जो इंस्पायर करें, स्टोरीज जो बदले जिंदगी। साथ चले सीखे हम, हर बात में एक नई सोच। होप से भर दे हर कल को, हर दिल तक पहुंचती आवाज। ये है Wellbeing Voices, जहां conversations inspire better lives.
Welcome to Wellbeing Voices with Harbinder Narula. Every healthcare leader has an impressive biography. They have a lot of achievements that they've accomplished. They have awards, they have positions, milestones. But sometimes the biography does not tell us what shaped the person behind these achievements. At Wellbeing Voices, we go beyond accomplishments to explore the decisions, the dilemmas, the values that define the extraordinary lives. Today I am honored to be joined by someone who has transformed the way surgery is practiced in India, from pioneering laparoscopic surgery in India to the first few to adopt robotics as a surgery, from training generations of surgeons to working on some of the highest profile patients. His journey is of courage, his journey is of curiosity and continuous reinvention. It is my privilege to welcome Padma Shri Dr. Pradeep Chowbey. Thank you so much for joining us.
Thank you so much. It's such a pleasure to be invited for this discussion.
Dr. Chowbey, when people introduce you, they often begin with your achievements. Padma Shri, pioneering surgeon, innovator, teacher. I'd like to begin somewhere else. Looking back at your life, what do you think actually shaped the most, whether it was your successes, whether it was the setbacks that you faced ever, or were these experiences shaped by the people that you met in your life?
Well, I think everybody has got a temperament, and it varies from person to person. And now at this stage, and I realize that my temperament has been to be a leader, in the sense having everything under your control, and also temperament of having a team rather than being individual person. So I think this temperament is very important in deciding that what you want to do. So having said that, I felt that first of all I was attracted towards medicine because my father was a doctor, and so that was my first attraction to be in the medical profession. But when I joined my MBBS, I used to think that what I am going to do after my MBBS, and I realized that I would like to be a performer in my profession. And of course that performance comes in the surgical side.
Right.
And we have got a lot of surgical specialties like EI, ENT, and other
Correct.
plastic surgeons. But then I realized that in those days all these things were done by the general surgeon like me. So I thought it's a wide variety of surgical experience I will get, where I will be able to operate and possibly each and every organ of the body.
Right.
Because super specialties were not existing at that particular time.
Right.
It evolved over a period of time. So that is what I would say, because I felt that I am confident of what I am doing, I am confident of what decision I am taking, and I am confident that I will get a good clinical outcome after my surgeries. So possibly that was a motivating factor. And as life progresses over a period of time, things have changed. Say we moved into from general surgery to specialized surgeries, and that is how the things have changed. And fortunately, I try to keep pace with the technology and improvements taking place in the world.
And Dr. Chowbey, in your journey, like I said, you have already worked on some of the most high profile patients. You have met some of the most high profile people as well as people who could not afford any kind of surgery. Is there some lesson that you have had during this long journey of yours which defines every decision that you take today?
Well, I repeatedly tell everybody that human body and human being is the same. What changes is the position, post, bank balance, how many homes you have, how many factories you have. That those are all superficial things.
Right.
When it comes to human body, every human body is the same.
Right.
That what I mean by that, that if somebody has got a particular problem, the person may be whatever he is, but the problem and the solution is the same for everybody. So for me, yes, I would say that I've dealt with possibly the high profile people as well as the absolute commoners also. Fortunately, I operated even Dalai Lama, who is a spiritual leader,
Right.
and has got not belonged to any community, any sect or any religion. But I realized that if you take the person and the problem same for everybody, then you can do the best. So anybody who is sitting in front of you with his problem, or any patient who is on the operating table, that time I don't think who the person is, because I feel that one human being who has trusted his life with you is lying on the table. I am not aware of the bank balance of that person. So I would like to do the best for that person, and get the best clinical outcome. So I would say that I can be confident that my clinical outcomes will be the same for the poorest of the poor person or to the richest of the richest person.
What you just said is a very beautiful thing, because what it makes me believe is that there are certain things in life which are a very strong equalizer, where it does not matter who you are, what background you come from, what position you hold, position in terms of money or in terms of power, but at the end, this is where every human being is equal to another.
Yeah.
Dr. Chowbey, there are thousands of surgeons, and then there are those who pioneer technologies, adopt newness in life, adopt newness in everything that they do. What sets you apart from everyone else? Because you have been someone who has always looked at innovation, adopting innovation. What sets you apart from everyone else?
I think my curiosity, because I am a very curious person. So whenever I see something, I want to know about that, whether it matters to me or not. If I go to the airport, maybe if something is happening to the aircraft, there are some chokes which are put in front of the tires of the aircraft. I get curious how they are put, what are the shape of that thing. So that curiosity brings anything which comes new. I am curious, and sometimes that curiosity also becomes materialistic, like your telephone, like your car, like your clothings, like your gadgets and things like that. So my curiosity is like that, and that curiosity keeps me going. So when I have done something, I have proved that this is very good, but my curiosity says that we can do this area better than the other, which include maybe nausea or vomiting or sickness or pain, those things. I see we can manage it better. So I am very confident that I am managing those things today better than I was managing those things yesterday.
But as a surgeon, when you are, responding to curiosity and looking at working on something which is unconventional, something which is new technology, does it sometimes scare you when you're doing it for the first time?
Well, I think yes, there is a certain anxiety. But before that anxiety, you have to do your homework and your common sense, your acumen for that particular thing, whether it will work or not. And only when you are confident, of course, you are confident about that with little anxiety added to it. And I feel that anxiety actually is productive. That anxiety brings best out of you.
Fantastic. Yeah. And Dr. Chowbey, when you look at successful lives, successful journeys, we always look at the achievements, the milestones that they've had. But I'm sure there is nobody that at least I've come across who has never had challenges or dilemmas that kind of brought them at the crossroads. Were there any such dilemmas that you ever faced? Because when I look back at your journey, you've had the opportunity to do a lot of other things which were equally passion for you. For example, not many people know that you are a pilot and a passionate one. And were there any dilemmas that you had while you were picking up a career that would become or would define your future?
Yeah, some element of dilemma, some element of ambiguity was there. But I think if you do a good homework, if you whatever you are trying to do, if you do a good homework and you prepare yourself. So if you are a marathon runner, you have to prepare for that day. You can't just get up and say, today I am going to do a marathon, this thing. So there are a lot of things goes behind. Once actually you come on the practical, on the operating table. So I think you have to spend a lot of time, and this is where I feel that many of us fail, that we are not able to put that much of background work, research work, background work, and to reach to that level where you say, okay, today I can do this particular type of surgery with this particular type of instrument or gadget. That's also there. Of course, I say failures could be there, because those failures are the bigger and greatest teachers than the success.
Right.
According to me, the success doesn't teach you anything. The failures teaches you the most.
Right.
The success just brings laurel, but failures, churns you up. Your thinking that why you failed in this particular thing, and that one failure possibly will lead to thousands and thousands of successes in the future.
I think you're right, because only if we were to look at failures and re-term those as setbacks, which help you take a step back and rework on it again. But while I say that, sir, when you are so passionate about something, I can understand that you probably found your ikigai when it comes to surgery, where you found your passion of creating an impact. You are super skilled in what you do, and it also helps you build a profession around it. But then you always, sometimes, at least I do, when I'm passionate about certain areas of my life, and I feel that I'm not able to devote as much time to that as I would have liked. But those defining passions also bring in some kind of a learning in my day-to-day job. Is there something that being a pilot has taught you which today is useful to you when you're performing surgeries or in the field of medicine?
Yeah, I'm sure. I think, as a pilot, you are the boss, you are the captain of the ship, right? So that is important. And I feel that I can do better as a captain of a ship because I strongly believe in the teamwork. And that is the reason why the team which I'm leading and heading, and is the team which is with me for more than 3 decades.
Right.
So, not a single person has left. So, it's a big confidence I have in the teamwork. And as you rightly said, the pilot, because maybe my alternative, this thing would have been as a pilot, because I feel that the pilot is in the control of the ship, but he needs the teamwork to make him to reach to that stage and do a successful journey.
Yes.
And that there are people who are individualistic. They feel that okay, they can do it, but I'm not like that. I know my limitations, that I can do only this much, and that is the reason why I have to believe in my team. That I know that that team will bring and multiple, the things which I am lacking. So I strongly believe in that, and unless you are a team, you cannot grow.
Right.
The individual person can grow to a very limited heights, but if you want to achieve greater heights, you have to have a team which whom you trust, whom you even groom.
Right.
You groom your team to come to their expectations, whatever assignment they have been given. And that is what, with motivation, I think you can have a very strong team and very stable team, because we all know that the most stable structure is the pyramid,
Absolutely.
So pyramid is the most, you have to have all those angles, all those sides. Then only you can become a pyramid which can stay there for hundreds of years without
Absolutely.
getting damaged,
I think, what you're saying is also very, very important, that I think the mature person is the one who knows what they can do best, but they also know what others can do better. And since you're talking about the team and the importance of having a trusted team, and you also have a background of believing in innovation, were there any times when you took the unconventional path, you were doing something which was different, something that was new, and people around you did not have that conviction, but you had that gut feel, that grit, that I must give it a try? Can you explain, is there some kind of a situation that you've gone through which is similar to this?
Well, I think many situations in my career, almost of 5 decades, many times, and I've done quite a few unconventional things also, getting convinced that those unconventional things are for the betterment.
Right.
So I think if your thinking is positive, and if your thinking is transparent, and your thinking is in the right direction, you are likely, with your curiosity, to get into something which is good and better. And also I give lot of importance to safety. Safety in my life, safety in my profession, safety in my surgery, because I strongly feel that whatever is safe today, tomorrow it should be safer than the day today.
Right.
And yesterday something which we say it is a safe surgery, next day it becomes unsafe surgery.
Right.
Because we are thriving for making everything safer than safer, better and better, less problematic, less comfortable, discomfort providing, less pain. So I feel that is important, and I have seen my journey. I started as a conventional surgeon, as a surgical oncologist for cancers, then moving on to laparoscopy, and not only moving on to laparoscopy, but particular area of laparoscopy, moving on to different areas. We started with diagnostic laparoscopy, moved on to the gallbladder surgeries, moved on to the hernia surgeries, moved on to solid organs, moved on to neck, which is not amenable to endoscopic surgeries, and things like that, including the last decade when we moved on to the robotic surgery. So we are convinced about the safety of whatever we are doing. So, from open surgery, when we moved on to laparoscopy surgery, we looked at the safety of the laparoscopy surgery, and we decided that we will go back to open surgery if we find that laparoscopy is not working or could be harmful to the patient.
Right.
And exactly the same way now, say like what we talk about the robotic surgery, because that is the future, that is what we are convinced that this is the way forward for practically all surgical interventions of the human body. May it be abdomen, may it be chest, may it be heart, may it be eye, may it be joints, everything.
Right.
So, that is what conviction is. And why we are moving, first it is the technological advancements
Right.
which are happening over a period of time, and we are trying to keep pace with the technology. At the same time, as I said, my basic fundamental principle is that we should make everything safer for our patients.
Right.
So, what was safe maybe 10 years back, today we have got safer options where we should provide them with a safer option. Maybe tomorrow I will change my mind and think of some other things which will make even what is safe today, which will make safer tomorrow.
Right. Now that of course is a evolution that is continuous. But I want to go back to my question again. Is there some instance that you remember in your journey where you wanted to do something and everybody around you was in disbelief of or not convinced about doing it, and later on, they realized that it has worked, but it was purely because where you believed in yourself despite everything around you not falling in place?
Well, I think that reminds me of my what time I spent during mountaineering. I used to be with Mr. Tenzing Norgay, who was the first person to climb. So, I was training with him for 3 months for mountaineering and this thing. That taught me one thing, that you can damage your body. So, you have to be again safe yourself. In spite of everything, you will injure yourself, So, you have to have confidence in your body, but I feel that the next level of confidence comes from your thinking, your brain, So, what you said, everybody was against. So, when I started laparoscopy, I think the conventional surgeons, we were just few of us who doing laparoscopy in the country, but conventional surgeons were very much against us. And as I must tell you that we put clips on the arteries
Right.
to detach the gallbladder or detach the structure, those are titanium clips. And when I used to put clips and used to get out and during that live demonstration, the big professors, very experienced, respectable, so they used to say, look, you are put in a small little clip there. How do you think that it will not slip and come out? When we put ligatures, even it comes out. So, how you are confident about that small clip?
Right.
So, there was total this thing, that this will slip, this patient will bleed post-operatively. And I used to feel confident that okay, this clip is meant for occlusion. And they used to say, heartbeat, how many times? It's 100 times beating every minute. So, it's pushing that clip again.
Right.
And I used to feel confident that no, wherever I put the clip, it will not slip. So, I had the confidence in the technology, what was there. So, I think I faced every stage of this thing. I started bariatric surgery, obesity surgery almost 25 years back. So, everybody used to say, where are the obese persons? Why you are operating them?
Right.
But I was convinced that surgery is going to help them. And over a period of time, we have proved that bariatric surgery and metabolic surgery is a standard form of management of obese persons. And a lot of lives have been saved and the quality of life has improved in last so many years. So you have to have that confidence, and I think not only you, somewhere else you are guided. There is somebody above you who guides you if you are the right material. So they possibly put their energy into you
So
as
you
well.
believe in if the intent is right, the
Yes.
divine intervention
Yes.
is there.
Ultimately, it is the intention.
Right.
What is your intention of doing something? If maybe that clip would have slipped, but my intention was to put in a safe clip.
Right.
So my intention was clear.
Dr. Chowbey, for anyone who, especially in the field of medicine,
Yeah.
who has had a successful career, who has adopted to new technologies, who believes that there are things that I don't know, that is a mark of a learner, a continuous learner, right? And it is not only when you learn from a mentor or you learn from somebody who's more qualified than you could learn from someone who may just surprise you with things. And in my conversations with a lot of doctors in my book, I have realized that many times they have learned something from their patient.
Yeah.
Is there something that you are able to recollect, some situation where some patient, through your experience, taught you something which is now becoming a part of who you are, a part of how you do things?
Well, I think this practically happens every day. What I think, the patients may not tell you directly that what you should do.
Right.
But the patient's behavior, their expression, their sufferings can tell you that what you should handle first. So for a patient who has got a dry mouth, maybe because of some medicine, does not need anything, but he needs just a sip of water
Right.
to make him comfortable.
Right.
So though he is not teaching me, but if I am sensitive to what he is telling, and also I am trying to analyze how can I help. There are some medicines which will produce, say, dryness. I have to give those medicines.
Right.
But I should try to find out that how I can make him more comfortable. So what you have said is the patient may not tell you what to do, but patient will tell what he is going through, and it is your responsibility to pick up those small little things and say, can we help or we can't help. So sometimes today you feel that you can't help, but if you keep on thinking, tomorrow you find that yes, I think we can help in this respect, only because you are thinking on those lines. So the patients teaches us practically everything except the technique of operating, but to make that operation good for the patient medically and not very difficult experience or complex.
One of the things about being an innovator is also the risk-taking ability.
Yeah.
Like you said that when you did your first laparoscopic surgery, the conventional surgeons had questions, and it's not that they did not have, it's not that they had a doubt in your abilities, but they were not sure of that procedure itself. Where does the surgeon draw a line? I know the intent is the patient outcome, intent is to do something better, less painful, faster recovery. Where does a surgeon draw a line between the intent and the risk that is involved? Is there something, because the reason I'm asking you this is because this is something where the younger surgeons would love to know what to do and what not to do.
No, definitely. I think there are a lot of innovations which takes place in all the field, medical science, surgery, medicine, everything. Now, as a younger surgeon, I would say, younger doctors, younger physicians, what I would just say that you should try to see the intention about it, whether the drug is expensive, so maybe somebody is interested in expensive medicines, but does that quality matches? This is same in surgery. The technology changes, and I can tell you that I must have adopted, you can say, pioneering technology, but I also have given up maybe 9 out of 10 technological developments which have taken place,
Right.
and I picked up only one,
Right.
because the 9 technological developments were simply technological developments which I was not confident, and over a period of time it has proved that what I thought is a right technology and what is not a right technology, because ultimately research and development takes place in all the fields.
Right.
Everything new will come out, but you have to, as a professional, you have to see whether this is actually a good thing or is just one of the innovations. You have to filter out those things, whether it is a money making innovation or if it is a just an innovation with no great benefit to the clinical outcome. So I think as you get experienced, and if you see other things happening, and also you can learn from others' failure.
Absolutely.
That again is a big teacher. So you don't have to have a great mentor also, but your mentors could be the others' failure, could be
Right.
mentoring you that okay, this is what I should not do.
Right.
Because generally mentors tell you what to do, but I believe that there are certain mentors which say what not to do.
What not to do. So you have to keep your eyes and
You
ears open.
have to keep your eyes open.
Right. And sir, you know, in your last answer, you also spoke about that, you know, the cost part of it. How does also, I'm going further from where we were talking, that how do you also draw a line between doing something which is modern, doing something which is more progressive, but it is also more expensive?
Yeah.
Okay? How does, especially in a country like ours, where we may be the cheapest in terms of our medical facilities, surgeries, when you compare it to the globe, but we are still unaffordable to a large part of our country. So, where do we draw a line between technology and affordability when it comes to our patients?
Well, I think, you know, my drawing that line possibly will be on safety. So, quality is important, but safety is definitely very important. And I am very sensitive to the cost. Everything which I add for any patient, I always think that, you know, this will add a cost to the patient. But whether I am going to use it or not depends on my conviction and my intention that that added cost is going to add the safety of the intervention, and also may reduce certain, you know, areas which may not be related with safety, but are important for that particular individual. For example, cosmesis, you know, it has got no relevance when we talk about any surgical aspect or any life-saving operations or this thing. But we have to think that okay, this particular cosmetic outcome will be better for that patient in a long term.
Right.
So the person gets cured for a particular disease on the day it is operated, but it leaves some unintended memories which are scars, you know.
Right. Right.
So how the scar is, where the scar is, how good or how bad the scar is, you know. So after safety, these small little things I always consider.
This is really interesting, sir, because you know, when as a surgeon a patient comes to you, you know what should be done, what is the right thing to do, what is affordable by them, but that can also be very better managed if you know the patient well beyond the symptoms.
Yeah.
When you know what kind of a background he comes from, what kind of a lifestyle they have, what age that the person is, like you said, scars. How important would it be to not have scars in the later part of life, etc. Do doctors in India or surgeons who have such a huge practice, there's a wait time, do they have enough time to spend with the patient to understand their background so that they could do something which is going to be the right thing for them?
Well, I think actually if you are sensitive, no, it doesn't take much time to understand. You know, if you are alert and you look at the patients, their behavior, the way they talk, because some people are not interested in technology at all. They are not interested how much pain is going to be there. What is their interest? That they can't afford anything else, So I would say I give them a wide range of the options, whatever is them according to me. So we give them types of rooms which are going to take. They will want to go for shared rooms, luxury rooms, super luxury rooms, because some people would like to have a super luxury room. That's how the class is created, in the society also,
Yes.
what you would like to wear, what you like to have, what telephone you like to have.
Right.
Basic telephone.
Yes.
For somebody, the basic telephone is the best he can afford.
Yes.
He is connected with the family, he is connected with this world. Then maybe you would like to may not be happy with the present best system which you can afford. You would like कि इसमें ये थोड़ा सा है, the company should improve iPhone 17 into something different,
Yes.
So I think it's important to understand what is the requirement. Fundamental is that there should be a good clinical outcome. That is fundamental.
Have you ever been at the crossroads of decision making where you feel that, I think this is best for them, but they are not listening to me, or they have constraints like affordability, etc., and you are at a crossroad of tough decision making or tough choices? How did you manage those?
Well, my management strategy is very simple, and I don't want to make it too loud, but if I feel that there is something which the patient needs and he comes to me with full confidence and possibly he cannot afford, what I do is I chip in for that particular segment. I will not chip in for cosmesis.
Right.
I will not chip in for anything like that, but maybe I will chip in for something and possibly the patient will never come to know about it. So I chip in on that even if he can't, but he has come to me. I can't do it for everybody in the country, but anybody who comes to me with that confidence and I feel that genuinely he is not able to do it, then maybe I will do it at my own.
I'm sure that is a very, very fulfilling experience.
But I never mention.
No, I'm sure. It must be very fulfilling internally for you.
It gives me a joy.
Absolutely.
It gives me a
To
happiness.
give back to the
So
society.
I do it, I would say, not for my patient, but maybe I am doing it for my
Absolutely.
happiness, and
Absolutely.
you feel good about it.
I'm going back to what we were talking of some time back, where we were talking of curiosity.
Yeah.
Just knowing or understanding the background of the patient, what he wants versus what they need, and doing the right thing for them, it is an outcome of curiosity.
Yeah.
Now, I feel that every surgeon, every doctor must have some level of curiosity. Do you think you are blessed with this from birth, or is this something that everybody can cultivate in themselves as they progress in life?
Well, I think I would say that everybody is curious, but after curiosity they don't take next step. They are curious that why this is happening, and that's the end of it.
Right.
The only difference has been that I am curious and I work in that direction to see and get answer of for my curiosity. So I think this is where some people will differ. Some people, everybody will be curious why there is a sound, happening. There is a loud sound. The other person is says, okay, there was a sound, but he doesn't know what it was.
And does not
The
care.
it does. He may not bother.
Right.
The next person will say why there was a sound, what happened at that time, whether some connection is wrong, there's something, there is a friction which is coming, why the car is making a noise,
Right.
So somebody will have that curiosity, but then he will not work on it. Maybe if my car is making a noise, I am curious and I will probably take it to the conclusion that why that noise was there and how we should sort it out, that noise.
Dr. Chowbey, now I want to move towards something which is very, very fundamental to the field of healthcare and is a part of every conversation that I do, and that is trust, faith.
Yeah.
What does trust mean to you?
Well, I think trust actually is everything. So, and that will define your success and failure. So, for example, a person comes to you with a trust, and if you come to that expectation of the trust is for the patient's trust are very simple, that they want to get your advice whether what should be the next course of action.
Right.
For a physician, somebody comes and says, okay, I have got a fever. The physician should say what investigation, what medicines, what possible diagnosis to be done. Anybody who comes to with me for a particular problem, then he trusts with me to guide him from there, And if I come to his expectation of trust and I give him what the trust which he has got and I reciprocate that trust, then this is a success story. But he comes with a trust and you don't give him that genuine advice, that trust is gone. And it is not gone for this particular individual, but it is gone for whomever he meets. He will say it's not trustworthy. And if you give them the trust, whatever they come with, and you come up to their expectation, give them the right advice, your intentions are clear, then he will pass on this message that okay, such and such professional is trustworthy. And that also makes a difference between success and not so success.
But so, when you're looking at trust, most patients when they come in, they are oblivious to what technology you're using, what goes behind the scenes, and they also do not know what they are wanting.
Yeah.
Especially the younger generation of patients, they're like, I'm not getting the right feeling.
Yeah.
What do you think is something that the doctors or medical fraternity or surgeons can do to build that trust in the patient community?
Well, I think the biggest, what you said about the young persons, the young persons are not trusting the professionals. The young persons are trusting the ChatGPT.
Right.
That is what I feel is the biggest problem of future generation.
Right.
They believe in that. What Chat says, that is right, and what the professional is saying is not wrong. I feel that all internet, all these things are good for tourism, is good for shopping, but when it comes to the professional, this thing, whatever profession it may be, I think those are not really, they are more confusing than the digital information which the patients are having. And this is the biggest problem which I am sure we are also facing and the next generation will also face. And that will be big conflict, that the ChatGPT says this and you are saying this, whom should you follow? And the guy will get confused to follow the profession or to the digital outcome.
So you just used two words, and my next question I want to ask you based on that. You use the word profession and you use the word conflict. There are two things that the patients bring their attention to when they come to a medical facility. One is the dedication of the doctor. They are very, very judgmental about what they feel, whether the doctor is dedicated to the profession, to the outcome or not. And the second thing is that their discomfort, the patients or the patient's family's discomfort on somebody's financial excellence, you know. How do you personally reconcile the professional excellence, financial sustainability for yourself, and ensuring the spirit of what we call in India the Seva Bhav?
Yeah.
How do you balance between these three? Because people are very, very judgmental about how much money the doctors make.
Yeah. Well, I think it's very disturbing for any professions, and I think the doctors and the medical profession is a very soft corner where you need an emotion also. You know, so when you buy a car, you don't need any emotions. There is a product, you go around, see everything, look at the cost, what comes to it, and that's all. That's what, you know, everything is mathematics.
Correct.
Everything is aesthetic. But when you come to a professional, sometimes the professional may tell you something which you feel is, there's no way you can possibly evaluate whether it is the right thing or not right thing.
Right.
But as we said that it's a society, and the doctors and the professionals are also from the same society. So, for example, suppose the society feels reaching on time is not important. So, the doctor will also not reach in time. The lawyer will also not reach in time, because it is the society.
Right.
But maybe some society, some country, time is very important. You have to reach on time, right?
Yes.
So, the doctor will also reach on time, the lawyers will also reach on time, everybody will reach on time, because it is inherent from the childhood they have taught that time is important.
Correct.
So, I think it is very important. The professional expectation should be balanced with the social this thing.
Expectations.
So, you expect the doctor to be there on time, but you don't reach on time.
Correct.
Right?
Correct.
So, these are the discrepancies which comes. So, for a particular thing you talk about financials, there may be definitely financials. So, you want to have a particular thing done by a particular doctor or particular professional. You want to have a location, particular location. You want to have the best gadgets, you know. So, everything today, you know, today I think we are at par or maybe ahead of even the Western world.
Correct.
We get the gadgets which much before the Western world gets it, you know.
Right.
So, that adds to the cost. If you want to get a good quality, you have to keep getting everything upgraded, which costs money, you know. So, that is important, I think, is a crucial thing, and there should be, there will be a gap, I am sure, but the gap should not be too much.
When I talk about ethics, sir, there are two things that actually trouble me, and since you are focused on innovation all the time, you are just the right person to answer this. One is, a lot of medical professionals, doctors, surgeons do not upgrade themselves to the newer technologies, right? Is that unethical? And second is, India, when it comes to innovation, is also known for frugal innovation. You know, we are not spending as much time. वो हम जुगाड़ निकाल के उसका तरीका निकाल लेते हैं, you know? But here we are playing with lives, and we have been shouting about the frugal innovation, especially during the pandemic, which was the need of the hour. But these two things, you know, I have not been able to find an answer, and I think, so one is the lack of updating yourself as a doctor. Second is frugal innovation versus planned, sustained innovation.
Yeah, I think professional updation is important. You know, you have to update. But to what extent you want to take that level, it will depend where you are. So, suppose you are in a small town, you know, you may not update yourself,
Right.
but you should know that who is the updated person, right?
Right.
That is important. So, you know your limitation. Every professional should know their limitation, that okay, we can work up to this limitation, but if it is beyond this, this is the person who can do it. And then that person also knows their limitations, where ultimately it is the tertiary care ultimately it goes to. So, I would say that the primary care person should know exactly what the primary care is. At the same time, he may not enter into innovation, but I feel that strongly he should know that this something exists, a better medicine exists which is not there in that place.
Okay.
Better technique exists in that place
Got
which
it.
is not there. So, he should be able to guide them what is important. Then updating for that particular technology may not be important, but knowing that there is a particular technology available is important, and
Correct.
who can do, where it can be done.
Right.
That is how the medical concept came of primary care, secondary care and tertiary care, you know.
Right.
So, whatever is the best you get in a tertiary care, but everybody may not need a tertiary care. Lot of filtration takes place.
And what about innovation versus frugal innovation?
Same frugal innovation. I think lot of innovations are meant as a money making innovations.
Right.
They are not the genuine innovations. Their intention is not correct.
Correct.
So, as a professional, you should be able to make out that this innovation is a good innovation, but means nothing
Right.
to the outcome.
I think there are, two things that are happening. One, what innovation typically does, where doctors must upgrade themselves over a period of time, may not be the most modern which is available, but I think this basic standard of care is evolving every year.
Yeah.
Where the basic that should be provided is becoming better with time.
Yeah.
And I think that basic has to be maintained. And second is, I think, where in my opinion we have lacked in terms of innovation in India is, while we have lot of incubation centers that have come up, lot of institutes like IITs are also encouraging development, but I think the medical fraternity, the doctors are not being involved in that innovation. So they are creating something which they think that the surgeon needs versus actually building based on what the need of the surgeon is.
Yeah.
So I think these are two things that need to be, the attention needs to be brought to them, where the engineering and the surgery both need to come together to build something which is the need of the hour.
Right. I think, we have been doing reasonably well for keeping people up to date with the knowledge are the various conferences, the continued medical educations, CMEs, Zoom meetings, webinars, etc. So, I think what I have seen after the COVID pandemic, I think this has become very popular. So, today I think our primary doctors also should be, and I feel that they might be aware what is happening in the world, and it has become very interactive forum now, and I am very confident you will see the thing which is now, I think,
The outcomes are
outcome
going to be, will be seen.
we are able to appreciate it now, what it was 5-6 years back,
Right.
because they know that what is good for them, because there are a lot of genuine webinars which are taking place, which are teaching them. They may not do it. Say for example, robotic surgery, they may not do it, but they know that this is possibly a better option
Right.
for a particular surgery.
Right.
But they may not do it, it's fine, but they know, and then
What
they
are the
can
options available?
options are which are available.
Right.
So I feel that this is very very positive development.
Since you were talking about webinars, you know, one of the innovations that has happened, or at least the innovation that always existed, but the application has now become aware. People are able to do webinars, conferences online without actually having to travel to another city. But there's another development that I'm seeing happening. You know, earlier we used to go and watch movies based on the number of stars that the critics have given.
Yes.
Today we are visiting doctors based on the stars that appear on Google. With the advent of AI and social media, what is your take on the judgment getting created online? Is it working for the betterment, or do you think this is undermining or creating a false sense of judgment among people?
Well, I think you are absolutely right in saying that it is creating confusion more than anything else. And I think everybody is looking how to get a better star on the digital side, and everybody is becoming active on the digital media, which is in a way good, but I think there should be a cut-off line in morality, in your professional ethics, what we have discussed.
Yes.
To how far you can go,
Right.
what claims you are saying, whether that claim is scientifically proved. So
Right.
clinical outcomes, which you say, okay, this is the best technique, and the clinical outcomes are fantastic, but the literature, the studies does not support you.
Correct.
So it should be evidence-based statement what you make.
Fantastic.
There should be evidence-based.
Absolutely.
You can gaga yourself for anything, but if the evidence shows that, that is the right approach. And the person who is looking at it should also look at the evidence. What is the evidence?
Correct.
Say somebody, say young person who is 25 years claims that he has done 5,000 operations. So you should use common sense that at the age of 25, when you get qualified, when you get this, how can you achieve 5,000, how much time it takes to do 5,000 operations.
Right.
So I think when you are looking into these things, it needs your personal judgment also. How much is correct, how much is not correct. You know?
Right. And Dr. Chowbey, you know, one is the technical excellence. You may be technically brilliant, but then there are failures that happen, you know, and there are medical errors, and errors are errors that are accidental, or there are outcomes that did not happen the way we wanted. Do you think we are very, very unforgiving as a society in India?
Yeah.
Or even the medical profession, because the society is putting pressure on them, the hospitals? How can we make healthcare not just compassionate towards patients, but also compassionate towards our medical professionals?
Yeah.
I mean, we see, you know, doctors, there's violence against doctors. How do we create a safe space? Because if we do not allow for failures, there will be no development that will happen. But the failures in the field of healthcare are also costing lives.
Yeah. Well, I think we do not understand. I again and again I would say that we have to understand that the medical profession is against God, against nature. Okay. This is one bottom line if you are able to understand, and if you are able to convey to the general population and also our patients. What I mean by that, what nature wants to do, the doctor wants to undo that. Right?
Right.
So nature gives them the heart problem, gives them say disease, you know, because ultimately what is fundamental of nature? One has to be born and one has to die. These two things are 100%, right?
Yes. Yes.
Birth and death is 100%. What happens in between is the role of the professionals. You know?
Right.
So nature wants that the heart block should take place and the person should die, right? Because he has born.
Right.
At the same time, when a male and female meets, the nature wants them to produce a new life, right?
Right.
So these are the two ends which we have to understand. Now what happens is the problem. What I am saying is that the God says that okay, the heart should be blocked, the heart should stop, because God from half cell of male and half cell of female, the body is created
Correct.
of billions and trillions of cells, right?
Correct. Correct.
At the same time, God does not have a bullet.
Right.
He has to use those organs to destroy the person,
Right.
the creation
Right.
as well.
Right.
And we know all the organs and we know all the things. And what doctors are trying to do is work against nature.
Correct.
So what we may call error may be not actually an error. It may be the judgment which goes wrong. So somebody comes with a fever, the physician feels that it is typhoid, it turns out to be COVID. It turns out to be bacterial fever, you know.
Right.
Because on day one you can't possibly say. Fever is fever for hundreds of thousands of diseases. The fever is the presentation.
Right.
So what error, I think there is no intentional error, I strongly feel. There is no intentional error. It's a judgment which may be right, which may not be right. And judgment, as we all know in our life, day-to-day life also, we see lot of your decisions which you take. You know, you say, I will buy this shirt, and you find that it's not suiting you, you know.
Right. Right.
But you can throw the shirt away. But you don't appreciate that it was a wrong judgment to have that particular color or a particular size, you know. Same thing happens with a doctor also. So he thinks I should operate this way, that way. And the judgment he may go wrong in judgment, which is considered by patient as an error
But it was the right thing to do at that point.
at that particular time,
Right.
because it cannot be recreated.
Yes. Yes.
Suppose, you know, accident happens in a car, you know, you say if I would have stayed back and had a cup of tea, the truck would have passed
Right.
and I wouldn't have crashed with that.
Right.
It's a thinking, you know, backwards, which is never practical.
Right.
And I advise that doctors, I wouldn't say do they error, their judgment may go wrong.
Sir, you know, I when I'm looking at hiring my team, I look at attitude more than the aptitude.
Yeah.
Where I feel that they can learn something, you know, but if their attitude is wrong, they will not be able to learn also. But in the field of surgery, when you mentor young doctors, young surgeons, what do you focus on, or what is your take on their technical brilliance versus the way they think? What is it that you want to focus on most?
First of all, I think what you said, I strongly believe there your attitude will decide your altitude.
Fantastic.
That's one single liner.
Yes.
So if your attitude is good, and attitude is not one factor, attitude is combination of multiple factors. So as a surgeon, I would say your technical skills is one factor, your bedside behavior is another factor, your intentions are another factor, your knowledge about the subject is another factor, your gadgets which are available to you is another factor, and that bunch of various options will make it your attitude. If your attitude is good, then all these options which are good, then your altitude will be quite different. So that's how you see the balloons flying in a different altitude.
Yes.
You know, it all depends what has gone into that balloon. Some balloon will go to thousands of feet, some balloon will go to a couple of feet and fall down.
Yes.
So
Fantastic.
more philosophical things.
And Dr. Chowbey, you know, before you finally say that, you know, I'm going to retire, if there's one thing that you would want to see changed in the Indian healthcare industry, what would that be?
Understanding about the doctors, you know, like this is a professional which is very poorly understood by the patients. And as I mentioned in that when we are going to the doctor, we should not consider the doctor as a god. we should consider that doctor as anti-God, anti-nature.
Right.
So, what he is going to do is against the nature, what nature wants to do, and he wants to do it again. So, you have to understand that he has been given big responsibility of fighting with the nature.
At the patient's
Ultimately,
will.
nature will win.
Yes.
Ultimately, nature will win. So, doctors is just in between, and blaming the doctor for many of your abuses is also important. So, you abuse particular thing, you eat tobacco, you abuse your this thing, and then when there is a cancer in with that tobacco, you blame the doctor that the outcome is not good.
Absolutely.
You forget that you have been eating, doing something wrong for
Yes.
decades and decades, in spite of knowing that this is not good, this is not good for health.
Absolutely.
But when you want that health to be corrected by the doctor, you want it within days, within minutes, within weeks, where you have been abusing it for decades.
Dr. Chowbey, my last question to you is that while everybody is looking at achieving successes, being rewarded by the highest possible award, monetarily successful, happy family, what is that one thing that you would want Dr. Pradeep Chowbey to be remembered for 50 years from now when people look back at the healthcare industry?
Patience, hard work, and confidence in yourself. Possibly this is important. Nothing comes early in your life. So, a particular stage will come when we have worked that much, you will have that much money. When you have not worked and you want that money to come early, the award which you think that should be given to you today possibly may come after 10 years or 20 years. So, you prematurely start thinking and comparing yourself with something. Apple has to be compared with apple only, you know.
Absolutely.
Is important.
Absolutely. Dr. Chowbey, first of all, thank you so much, not only for taking our time, but also reminding us that excellence in healthcare is not just built on skill alone, it is also built on the courage to take the risk to advance betterment of the society through healthcare, the curiosity that actually drives you to do something better, to serve a problem that exists, and compassion and trust in your teams and the technology which is available. I truly, one learning from this conversation is that it is not just the technology, it is the conviction on your own ability using the technology to create the possible outcome that will make lives better is something which is imperative for healthcare industry to grow. I thank you not only for taking out time to be on Wellbeing Voices, but thank you so much for what you've done in the field of healthcare and its contribution to the society. Really, really appreciate what you do, sir.
It has been a pleasure. It has been a pleasure. A lot of my thought process have surfaced during this conversation, I would say. So, thank you very much for your absolutely apt questions, and which has brought my feelings to the surface, and is a wonderful conversation.
Thank you,
two
sir.
of us we
Thank
had.
you, sir.
Thank you.